Good afternoon, everybody, and welcome to our 2022 Annual Public Meeting. My name is Mark Butcher, and I'm the chair of the board chair of the Southern Adelaide Local Health Network, or SALHN, and welcome to our 2022 meeting. Our 2021 meeting. I'm so pleased that many of you can join us here in person. We were limited, of course, because of the restrictions with the pandemic. But to those that are watching on the live stream, again, welcome to our annual public meeting. I'm really delighted to connect with our community today to present on SALHN's year that was, and to talk to you about what is ahead of us. We also want to recap on what we've been hearing when you've been telling us via our community chats, a series of activities we've held with the community over the past 8 weeks. Today we have a number of speakers and we have a number of videos, including an introduction to our board, and then we have a panel discussion with the topic of looking ahead. At the end of the panel discussion, there'll be an opportunity to take questions from the floor, and we very much look forward to that, so thank you. I guess, importantly, as we've now opened our borders and with COVID and the restrictions, we've done so with a degree of confidence and with a lot of careful thought and a lot of planning. And we do have additional resources available to us. We have additional capacity, and at SALHN we're certainly doing our bit to support the statewide system in the response and in opening up our borders. In starting, I'd like to firstly acknowledge that we meet on the lands of the Kaurna people, the traditional custodians of the Adelaide Plains, and we pay our respects to elders past, present and future. And we recognise and respect their cultural heritage, beliefs and relationship with the land. And we acknowledge that they are of continuing importance to Kaurna people living today. I'd also like to pay respects and to acknowledge the cultural authority of Aboriginal and Torres Strait Islander people from other parts of South Australia and Australia. So on behalf of SALHN and the governing board, welcome and thank you very much for joining us today. And thank you also for those of you who have contributed to our community chats. And those are activities where we've actually gone out to engage with the community to hear from you about what's important and what's at the forefront of your mind about healthcare in the South. And during those chats, we've been listening and we've been taking notes, and we want to give you some feedback about some of the messages that we've heard and how we aim to act, make better together. It'd be fair to say that health has actually dominated the international headlines for the best part of the last 2 years. And down here in the South, we have both an incredibly talented workforce and a unique community which has faced the continued challenges of COVID and actually of high demand on our services, including our emergency department, which is the biggest and the busiest in the state. All through this, our staff have been at the coalface, and whilst serving our stakeholders responsibly, reliably and to the best of our collective ability. We acknowledge their exceptional efforts. I'd also like to acknowledge our former CEO, Sue O'Neill, for her time as our CEO, and also welcome Wayne Gadd as our interim CEO. I'd also like to recognise the work from David Morris and his achievements both at SALHN and now with a broader mandate around future planning for the state system. Collectively, we have a dedicated team of SALHN executive leaders, and they've ensured that consumers are at the centre of every decision and everything that we do. And I'd like to thank and acknowledge our executive team. SALHN is an extraordinary organisation facing these pressures felt across all health systems worldwide, and we've kept our community and our consumers at the centre of our decisions. I'd like to thank and acknowledge each one of our dedicated 8,500 odd staff for continuing to serve the community of the South with dedication, with empathy, with skill, respect and with care. To embed our operating principles of to listen, act and make better together, we've been focusing on building relationships with the community, with clinicians and with consumers. And this engagement continues to inform us and to give us a united voice about our strengths. It also brings to the forefront how we need to evolve in our modern healthcare, still reeling from the pandemic. Our community is diverse. It includes our staff, our volunteers, our consumers, our GPs, and partners such as the Flinders Foundation. Their voices help us better serve the South and build on the extraordinary community network going above and beyond. To provide a little bit more detail about these topics, we're going to be joined by Julie Mitchell, who from our board, who is the Community Engagement Committee Subcommittee Chair, who's going to speak to the Community Chats program, and Wayne Gadd, our SALHN Interim Chief Executive Officer, who's going to reflect on the past 12 months and who can talk about our future 12-month vision. Following that, we're going to have a panel discussion, and I'm going to introduce our speakers a little bit later. Our subject matter experts are going to discuss how we're looking ahead, and as mentioned, there'll be an opportunity for questions at the end of their formal session. Some housekeeping: we are being live streamed, and we've also been accepting questions for the panel at the registration desk. For any of you that are here presently that have another question, please put that on a piece of paper and hand that round to one of our friendly staff. And we're also allowing questions through Slido, which is a QR code that you can scan via the screen if you've got a smartphone, and use the camera function on the screen to scan the image, and we can show those questions a little bit later. For those that need it, loos are in the foyer area, but to access that you need to actually exit the building via the entry and then come back through theatre number 2. At the end of the meeting today, we've organised some afternoon tea boxes on the way out, but a friendly reminder, with the restrictions, we can't actually stand and eat. We need to be seated and eat, and there are a number of areas to do that, including in the central rainforest area, which is quite incredible to have in the middle of this MAB precinct. So look, thank you everybody for being here today. I'd like to now welcome Julie Mitchell to talk to us about Community Chats. Julie.
Thank you, Mark. Thank you. Good afternoon, everyone. Can you all hear me? My name is Julie Mitchell and I'm the Chair of the Community Engagement Subcommittee of the SALHN Board. We've been sharing our community engagement strategy via community chats over the past 8 weeks, and that finishes today with our APM, but that's just the start of our engagement across all of our the area that we serve here at SALHN. So community chats involved lots of different activities across our sites and within our community. We specifically created community chats for the community to get involved, be empowered, and share ideas for imagining the future of how healthcare could be, including on digital health innovations. As Mark explained, health is on all of our minds. We started with a panel discussion. We ran a workshop about what technological enhancements could enhance our experience of health. We held information sessions on new services. We hosted a listening post and asked you what sort of activities you wanted. Then after hearing from you, we went into the community like you suggested, and we set up a listening post at the McLaren Vale Hall with our COVID-19 mobile vaccination team. All because we want to create genuine dialogue and collaboration with the people who are connected to us. We want you to help shape our local healthcare system now and into the future. Caring for our community and consumers takes an entire community. Our staff, including clinicians, our consumers, our researchers, volunteers, all participated in the community chats activities, and we're very grateful for your contributions. Overall, you told us that our staff are doing a wonderful job, and we couldn't agree more. It has been another busy year for them. The COVID-19 pandemic has continued to disrupt all of our lives. There's been ongoing demand of all sorts of service, our emergency departments, and we're supporting a very large ageing population down here in the south. All of this while we were adapting to digital transformation and ensuring ongoing care for all of the people we do care for. Given that context, it was no surprise to learn you are interested in understanding what we are doing to reduce delays on the ramp, decrease demand across the emergency departments, and for elective surgery. This extends to how we are supporting our staff and our community for borders reopening, which we're in day 2, and so far so good. Soon our interim CEO Wayne Gadd is going to talk to these themes when he makes his presentation this afternoon. He'll tell you about how we've been busy planning in the background to support our system through this time. Other themes for our engagement with you were about how we plan to modernise our health system. This explains why most of our community chats activities focused on how digital inclusion has the potential to fundamentally enhance the way we deliver healthcare services and engage with our patients, staff, community and citizens. COVID-19 has accelerated digital transformation in ways that might have otherwise taken a very long time to come to fruition. From telehealth, virtual consultations to virtual hospitals internationally. I'm sure that most people here have already now experienced a virtual consultation with their GP. I know that I've had quite a few, and it's very efficient. We know that redirecting some hospital-based treatment to people's homes through telemedicine and mobile health is transforming health services to be more people-focused, to receive their health care in settings that are far more comfortable for people. And we use the community chats activities to unpack how patients can better get treatment with virtual reality tools, electronic sensors, wearable medical devices, and 5G, and using 5G mobile technology. When we asked you what we need to get right with digital health, excuse me, you said it needs to be consumer-driven, and we totally agree. You said you want clinician and community education to ensure people, including the most vulnerable, build their understanding about what this could mean for them in the way they receive healthcare. You said that confidentiality, cultural sensitivity, and reliability were really important. When we asked you about what excited you about digital healthcare, you said the opportunities about digital healthcare, increase in access to healthcare, adaptability, 24/7 care, creating capacity in the system that otherwise is at bursting point. More opportunities and choice in healthcare, more precise clinical measures, predicting outcomes and using data to our best advantage. When we asked what do you think digital innovation in healthcare is, you said making information accessible, including appointment details via text, changing systems, getting up-to-date healthcare, virtual clinics using touch screens and wearables. So many people today wear smartwatches that tells you a whole lot of things about your current state of health, from heart rate and how many steps you've walked and all those sorts of things. In order to understand how digital health will be used at SALHN, Wayne is also going to talk to you about that too very shortly. So on behalf of the board, we thank you for your participation with community chats. It's been really useful for us to hear from you about a whole range of things. And that is going to be ongoing. And I hope that all of you get the opportunity to participate in other things into the future. Community chats officially ends today, and we will put through an evaluation point. But in the pack that you've received today, there is a summary of some of the things that we've learned. So this is just the beginning of our partnership with the community. We will continue to create opportunities for you to connect with us and for us to connect with you, to share what we're doing and to learn more from each other. Before our CEO Wayne speaks to you, and so you can get to know the names of the people that support our community on the SALHN Board, I'd like to introduce you to our board, who have created something special for you today. And I will apologise in advance. We were given very strict instructions about being careful what was in the background of this, but my dog features, so I didn't mean that to happen. Thank you, everyone.
Hi everyone, I'm Tamara McKean.
I'm Virginia Hickey.
My name is Jill Noble.
Hi, my name is Terry Sweeney.
Tony Sherborne here, a member of the SALHN Board.
Hi, I'm Mark Butcher, SALHN's Governing Board Chair.
I'm a medical practitioner specialised in public health medicine.
I'm a fairly new board member at SALHN.
I'm a company director, a corporate governance consultant and a lawyer.
As well as being on the SALHN Governing Board, I am also involved in profit-for-purpose aged care and social housing organisations.
I've been on the SALHN Board since it was formed in July 2019.
I'm a Wellian woman and I've been living and working on Kaurna country in southern Adelaide for the last 9 years.
And I'm delighted to be with you here at our 2021 Annual Public Meeting.
My key reflection on the past 12 months.
Just how hard the team at SALHN has been working
To manage the COVID-19 pandemic.
My reflections of the last 12 months centre around the need for digitally assisted new models of care.
Has been the optimistic way in which the majority of the community and all those working within the health system have responded to the challenge of COVID-19.
It's clearly been a tougher year than we were hoping for, despite South Australia having it much better than the rest of the country.
A quick fun fact, I've never done a selfie video before.
I'm also an advisor to the G20 on the use of new and emerging technology and data to drive better health outcomes and equity across the G20 nations.
So you are my test audience.
Aside from the board, I work in primary care. I chair a primary care training organisation, and I also manage my own business where I consult.
You might be interested to know that I love making music. I play the oboe in the Norwood Symphony Orchestra, and I sing in a choir with my husband and 2 young adult children.
In my youth, I lived in Italy for quite some time and came to love the country and the people and the language and, of course, the food.
You might be interested to know that I'm a classical pianist, and as well as being on the Southern Governing Board, I'm also on the Cancer Council SA Board, a director of the South Australian Health and Medical Research Institute, and a director of the Independent Hospital Pricing Authority.
Community means everything to me. As the saying goes, no man is an island. We all depend upon each other in some way.
I also think that community to me means all of us. We're all in this together.
One of our greatest assets as human beings is our ability to care for each other with compassion and respect.
Community is at the heart of SALHN. You are the reason that we're here. And we put the patient at the centre of every decision.
Community means everyone, but community is not one single amorphous group. Community comprises many diverse groups with different needs, different priorities and different ambitions.
So I like to make my contribution to the community in a variety of ways, always bringing my governance and legal skills and experience.
In 2022, I'm looking forward to seeing how our expansion efforts meet the needs of our diverse community.
In 2022, the key initiative that I'm most looking forward to is implementing our recently launched clinician engagement strategy.
I'm very excited for 2022 with a new initiative we have to deliver quality care in place using digital strategies.
In 2022, the key initiative I'm most looking forward to is to learn how we can maximise the digital health opportunities identified through COVID, enabling our health services to be even more responsive.
In 2022, the key initiative I'm looking forward to is the increased use of technology.
In 2022, I am looking forward to meeting lots of people here in the southern area of Adelaide. I want to hear about what interests them, what they are concerned about, and what makes them happy.
In 2022, I'm looking forward to us emerging from the pandemic safer, stronger and happier, learning to live with COVID.
One more thing for 2022. Go the Eagles.
Thank you. I think we all learned something new about the board today, and I think we all enjoyed that. Hello everyone, I'm Wayne Gadd, I'm the Interim Chief Executive Officer for SALHN. I joined SALHN in 2016 as the Chief Finance Officer. Before that, I spent 8 years with the Department of Health and Wellbeing and across other LHN networks in roles of Executive Finance and Corporate. Prior to that, I'd spent a further 7 years with the Calvary Healthcare Group. It's been another year of uncertainty and our staff have risen to the challenge. While there have been challenges, we continue to be driven by a strategic direction map and achieving our mission of building a thriving community by consistently delivering reliable and respectful healthcare. Like Julie explained, we launched our community engagement strategy, but we also released a research direction strategy during Research Week, and most recently, our clinician engagement strategy. Other milestones over the last 12 months include the completion of the SALHN Health Expansion Plan, which builds the clinical capability of Noarlunga and Repat with services like the Specialised Advanced Dementia Unit, Arthroplasty Surgery and the Neurobehaviour Unit. We opened a Noarlunga Centre 7-day community vaccination clinic, introduced mobile vaccination clinic and administered more than 150,000 doses of COVID-19 vaccine. We relocated our COVID-19 testing clinic to the Bedford Park drive-through testing clinic to be more community centred. We welcomed 2 new board members, introduced the Geriatric Evaluation and Management Home Service, and a group of Aboriginal and Torres Strait Islander cadets started on their journey to become enrolled nurses at the Flinders Medical Centre. So it's been a very busy year for us. With regards to COVID-19, SALHN has been building capacity to support this system across the state for the opening of the borders. We have been looking closely at best practice ventilation requirements, bed capacity, boosting our workforce capacity, infection control practices, PPE equipment and requirements and infrastructure. We also created a number of COVID-19 booster vaccination mobile clinics at Flinders Medical Centre, and we will continue to play a role in community booster program from the Noarlunga Clinic. As the dedicated COVID-19 maternity hospital, we have been working to ensure our maternity patients with COVID-19 will be able to access our services in a safe and controlled environment. We would like to take the opportunity to reassure you, SALHN's senior clinicians and incident management team are working extremely hard to ensure every possible measure is taken to prepare for the border opening. These preparations and planning were designed to support you, our community, now that the borders are open. To explain, we have created this video.
Hi, my name is Sarah McRae and I am the SALHN COVID Executive Lead, and we have been preparing for the borders to be opening over the last few months. We've been looking at many elements for that, and that has been coming under the title of COVID Readiness Plan. That includes infrastructure, it includes workforce, it includes all elements for us to safely care for COVID positive patients and look after our staff at the same time. 85% of people who become COVID positive are to be cared for in their home, with in-reach and outreach into their homes. And then there's the 5% that we'd expect to see in our hospitals, and that's what we're preparing for here at SALHN. Flinders Medical Centre is the receiving hospital for COVID pregnant women across the state. They'll be coming from other LHNs and from our regional areas, and potentially interstate and internationally. Staff can protect themselves by having their booster, getting fit tested, so important, and keeping up to date with the PPE information, and then also keeping up with any of the information that's on our intranet site as well as our Facebook page. Staff need to look after their wellbeing through this time, and we do have options such as EAP. We ask that you look after each other, that you talk to your line manager, and that we also remember that these plans are very agile and they'll change regularly. So keep yourself up to date, but certainly reach out if you're unsure.
I'm Jo O'Connor and I'm the Co-Director of the Women's and Children's Division here in SALHN. SALHN is of course the streaming hospital for women who are pregnant and greater than 16 weeks, and they will come to us if they're COVID positive. We will also look after women who are less than 16 weeks if they have a pregnancy complication. Women who are COVID positive will come to us if they need to have a face-to-face assessment or if they need to be admitted in their pregnancy, either with COVID issues or with pregnancy issues. The rest of the state will manage the women who are booked with them who just need to have routine antenatal care, and they can do that by telehealth or telephone consults. So we will see the women if we need to send them face-to-face. And we will either admit them or assess them and send them home with the community-based care that the state is offering for women with COVID. For most of the women's journey, it won't change. Their care will be exactly the same as every other woman. Should they need to come in and have a face-to-face appointment or an admission, they may come in through a different pathway. They may come in and be guided through corridors to certain areas. We will have certain areas that are COVID areas and certain areas that are not. And then should women who have high-risk pregnancies or are sick with COVID, we will of course work closely with our intensive care unit. They are set up and ready to go for women who may need to labour in intensive care or may need care afterwards. So we're working across the hospital to care for women no matter how sick they are. So of course all our staff are double vaccinated, which is our strongest defence against COVID-19. PPE, we have good supplies of that. Staff are practicing that, they know how to doff and don. They are well aware of all the pathways and will become more aware as we do further ones. They are well prepared for this, they are ready to go. And yes, there'll be a level of anxiety, but I think like always we keep the women, their families and their babies at the centre of our thinking and our journeys. So it's business as usual for us with an added layer of protection. This is what we do as a profession and a discipline all day, every day. COVID has put another layer on top of that, and we are well prepared and ready to go with all of our structures and our processes and our flows and our PPE. We will manage them as we always do, and so we will make their labour and birth as special for them as we always try to do, and we will work with them during their pregnancy.
I hope that video gave you some insight in our preparedness plans. Moving on from COVID, I wanted to raise some important priorities. This year, we have also focused on key drivers influencing SALHN's strategic agenda, embracing digital in healthcare. Building on this, we introduced a new service called the Care Service based at the REPAT. The Care Service is designed to support older people to receive rapid specialist care and to avoid the busy Flinders Medical Centre Emergency Department. Building on these new models of care that integrate digital virtual care, SALHN is forming a 10-year plan that will contribute to addressing bed capacity challenges required to meet the needs of an ageing population. Our senior clinicians and management are working on health services planning, including the addition of digitally enabled care for patients and infrastructure improvements to ageing infrastructure at Flinders Medical Centre. We will be focusing more on this next year and look forward to providing more detail engaging with our community to have their input into the plan. We are optimistic about this critical work and are working closely with the Department for Health and Wellbeing and other important key stakeholders. Improving the delivery of quality patient-centred care into the future will involve engaging with the community, consumers and partners on our journey, and as Julie said, this is just the beginning. Thank you everyone. Before I welcome Mark back to the stage, we have a 2020-21 highlights video for you. Thank you.
Thank you very much, Wayne, for that informative update, which really sets us up nicely for the panel discussion. We know that redirecting some hospital-based treatments to people's homes through telemedicine and mobile health, we know that's actually transforming health services to become more people-focused. And often people need to be served in hospital, but sometimes they don't. Sometimes it's better to serve them somewhere else. It could be in a priority care centre, it could be in their home, in a nursing home, or somewhere else. And that is the way of the future, and that's what we're setting up for. We know that the community has questions about the planning that we underwent to support you before the borders opened, as well as, of course, the general demand that we continue to experience now and into the future. So in order to address these themes and to take some further questions from the audience on looking ahead, I'd like to invite our panel discussion and invite our panel speakers on stage. And as they're coming up, I'm going to introduce them. So perhaps if I can start with Associate Professor Tamara McKeon. Tamara is a SALHN Board member. Welcome, Tamara. Sarah McRae, who we saw famously on the video. Sarah is our SALHN COVID-19 Operations Lead. Sarah Woon. Sarah is the SALHN Acting Chief Operating Officer. Please come and grab a seat. Peter King, and Peter is the SALHN Co-Chair of Partnering with Consumers Advisory Group, and Dr. Diana Lawrence, the Executive Director of Medical Services. Here our panel, welcome, thank you very much. And hopefully you're mic'd up and all those mics are working. I thought I'd ask a couple of general questions first of all, and then open to the floor. To start with, perhaps if I can start with you, Di. What have your conversations been with clinicians on the development of digitally enhanced healthcare services, and how do clinicians feel about integrating a virtual strategy into healthcare?
Thank you, Mark. You can hear me, I hope. Look, our clinicians are really excited, and they're really keen to further embrace more digital technologies. As you know, we already have some in place in SALHN, and in fact I was privileged to observe rehab in the home recently with a physio over telehealth, helping a patient in their home with recovery from stroke, and it was remarkable. And I asked the patient about their experience, and it was so good for them to be in their home. So we have it in place, but we're really excited to do much more of it. And in fact, we're really more than ready to embrace what we can do with it. There'll always be circumstances, as you mentioned, where we do need to examine patients face to face, of course, but there are many, many times where we need to engage and talk with them, but they don't actually need to be with us. So very keen, very excited, very ready.
Thanks, Di. That's great to hear from a clinical point of view, but from a consumer point of view, the way that our consumers are actually engaging with healthcare has changed as well through telehealth and through COVID. So Peter, in your role, what are the sort of conversations that you've been having with consumers across SALHN around development of digitally enhanced healthcare services?
So Mark, there's been a lot of conversations regarding the new direction, and it's been really great to have, for consumers to be fully engaged in the setting up of the new direction and so on. That has also led to a number of workshops, and that will keep on going as we keep on going through. And I guess it's key to say that there's got lots of positives there, because I think there are a lot of people who are familiar with the technology and have been perhaps waiting for technology to be introduced more into the life of a healthcare system. So that's a positive thing and so on. The challenges will always be to make sure that people are engaged and people are coming along in the journey, and are also that everyone is engaged, because not everyone is technologically literate, not everyone has got the access to technology that it might be. So while it can widen the future and better healthcare, it also has the potential, if we're not really focused, for vulnerable people to be marginalised because of things not there. I've often said engagement grows at the speed of trust, and so therefore going forward, the trust is going with an honest a conversation with people about there's a range of options. Which one fits you? Which one works best for you?
Thanks, Peter. So there's a real, equity piece there, an understanding piece, and a trust piece, and that's sort of a nice segue. So as an academic and as a researcher, Tamara, how do you think we can actually better engage with our patients, with our consumers, with our community, with our citizens?
Thanks, Mark. And to build a bit more on what Peter was saying, engagement at the individual or at the collective level needs to be underpinned by things like trust and good communication. One size does not fit all, and I think we're all very aware of that. And so being able to engage people so that we can understand exactly what it is that is going to suit their needs, that is going to suit their circumstances, that is going to allow us to work well with other agencies and across different sectors in order to better meet the needs of an individual person and their family. We need to make sure we have that way of the rapport, the trusting conversations, and being listened to and being believed. Feeling like what you're saying matters, feeling like what's happening to you and your perspective of that is matters to the healthcare providers that are looking after you. I think Peter and I have both had some quite interesting experiences that make our comments today a little different than perhaps they might have otherwise been. But if we then think about what this means for us in terms of going into the future, those issues of equity and making sure that the way we go forward is actually with everyone and that we don't leave anyone behind, that is going to be part of the process of bringing people along as well.
Thanks, Tamara. It's essential that we sort of move in lockstep with our community, and to the point that Jenny raised in the video, our community is actually a very diverse and complex community that we need to serve, and so we need to adapt our approach to recognise that. In these sort of COVID times, and we're serving our community in hospital and out of hospital, and it's vital that we keep them safe. I'm really keen to hear Sarah McRae. What are some of the processes that we've put in place to protect our patients, our staff and the broader community from COVID when they're actually accessing health services in the south?
Thanks, Mark. I think it's really important to emphasise that actually it's not just a SALHN response, it's actually a statewide response, and we've been working collectively across all of the LHNs and coming together and ensuring that South Australian community is safe. So we've considered that in our preparedness through 3 phases, one being at a COVID surge, one being for an outbreak, and one for living with COVID. And there's been a lot of planning and modelling that has been done around this, and we've been certainly planning at SALHN around all 3 of those phases. The 3 COVID sites, we've highlighted today on the video that Flinders is obviously for the perinatal care, but Royal Adelaide is for adult care, and the Women's and Children's in North Adelaide is for the children and the paediatric population. The state responses, they've worked out 7 streams, and they are ICU, acute adults, mental health, regional, perinatal, paediatric, and lastly surgical. And through those streams, there's been representation from all of the LHNs and from regional areas to ensure that we come together and there's some consistency in our planning and approach to managing COVID to keep us safe. As highlighted in the video, and I think this is really important from a community perspective, is that we are trying to provide home and care for 85% of COVID positive people within South Australia. 10% will be a hospital in the hotel, and 5% we expect will be treated in hospital. So that's a small number that we expect that we'll be treating in hospital. Having said that though, we have to prepare for the worst case scenario. So we're prepared for, if it is a surge, what does that need to look like? And we've been extensively planning for our perinatal response and working in relation to making sure that we've got adequate flow and mapping of our COVID positive women through our hospital site, and how they can access and come to Flinders Medical Centre if they're from the other side of town, and making sure that we've got good supports for community members to be able to access our services at Flinders. Other high risk areas at SALHN are ICU and our ED department. We'd expect that we're going to be seeing COVID, but also suspected COVID, and they would call suspected COVID SCOVIDs, and we expect that we'll be seeing lots of SCOVIDs until they've had a clearance from their test results. So we need to manage them as we would manage a COVID. So there's been a lot of planning with our staff and a lot of planning, including consumer engagement, about how we can effectively care for both COVID and SCOVID. There's been infrastructure changes, there's been airflows, there's been a lot of planning in relation to mapping the flow of a COVID positive or a SCOVID patient through our hospital, but also how we can try and keep our sites as safe as possible.
Thanks, Sarah. I personally draw a lot of comfort from the work that's gone in, because it's just been a huge effort, and you're leading that effort, but I know it is an absolute team effort. And so as we do approach, as the borders are now open, I am actually confident that we are as best placed as we possibly can be to cope. But we were kind of busy, before we opened the borders, and so I guess Sarah Roon, you're our Chief Operating Officer. What is it that SALHN's been doing to build capacity and support in the system?
Thanks, Mark. First of all, ensuring timely access to quality care is our #1 priority in SALHN. And we know that there have been delays to care, whether that's been through ambulances or through long waiting times. And because of that, and in preparation for COVID, there's been a lot of planning and effort and resources into creating more capacity within SALHN to support this work. And that's included creating more bed capacity, but also improving the way we work in the hospital, from the front door in the emergency department all the way through our acute wards and into our rehab and aged care services and home again. So to create capacity, there's been an investment in 62 additional beds to prepare us for border reopening, and that's been a mix of physical beds and also what we call virtual beds, which are care in the home and close to home. These beds are created through partnerships, so we've partnered with the Flinders Private Hospital, which is co-located with us at Flinders Medical Centre. We've got additional mental health beds in preparation, and we've also increased the capacity in services and in beds for older people, for those needing rehabilitation and end-of-life care supports. So you would have seen today as well in the highlights package, we've also developed and invested in programs such as the CARE program, which create alternatives for, in that example, for older people in Southern Adelaide, alternatives to emergency department care. And we've also created alternatives to hospital care, so other pathways for people to access care when they need it.
Thanks so much, Sarah. Perhaps I might open the floor for questions, so we'll open up to our audience. Anyone from the panel can jump in, and if you haven't had the opportunity to ask a question at the check-in desk, we can do it via Slido, and as you can see on the screen there, the code is #103215 after you scan the QR code, and the code will appear on your screen. So can I open up? Fran. Oh, we've got some questions here? Yeah, that'd be great. So we've already received some, and if I can just ask Fran to...
I like to take over. My name is Fran. I'm the head of communications and media here at SALHN. And because I have a mobile phone, I will be delivering some of your questions today. We'll also have Britt over here from SALHN, who you can give your sort of pieces of paper here which has your question on it. So I might start with some questions on Slido, which we already have, but make sure you scan here, you put the digits there, and you can ask away. So we did have a question here that maybe is best for Sarah McRae. There's a few COVID ones. How will SALHN cope with a surge in COVID patients? So when we get to sort of quite a lot of patients, someone's asking, how will SALHN cope?
Yeah, that's a good question, and a question that I frequently get asked. And this is where I was talking about it being a system approach. So it's not just SALHN that would build the capacity, it's across all of the LHNs. We are a tertiary veterinary hospital, and we will need to work very closely with the Royal Adelaide. So the Royal Adelaide has huge capacity. It is a pandemic hospital. But if there is a surge and they get to capacity, we will need to make capacity at SALHN to be able to facilitate some of the flow of their patients coming to us. So what we've done is we've worked with the private providers, but we're also working very closely with SALHN as well. So we do have a strategy in relation to being able to free up capacity at SALHN to be able to assist with a surge and take patients from the Royal Adelaide if necessary.
Thanks, Sarah. That's great. Another one here is, and maybe for Di and Sarah Wynne as well, how will SALHN use digital during COVID response with borders opening? What's our strategy with digital?
Do you want to talk to that? Do you want to start? Oh, do you want me to start?
Yeah.
Okay. Well, we did use digital health from 2019 and 2020, so it's sort of, dusting that off and refreshing. So the clinicians are very familiar with digital health, and so we are talking about that currently now. A part of our planning is it's called a COSTAT plan, so it's trigger points in time where we will actually escalate, and then we'll be able to facilitate, okay, we might need to reduce face-to-face and we'll go into the digital health area. At the moment, we're in COSTAT 1, which means that there is no transmission in South Australia, and COSTAT 2 will be where there's, low, 3 is there's a widespread, and then there's 4, which is sort of untraced widespread COVID in the community. So we have aligned all of our care against the COSTATs, and that's exactly what all of the other LHNs have done as well. So there's an alignment across the state that we know that when we get to COSTAT 2 or 3, that we will then escalate and then we'll revert to digital health. Where we'll reduce the face-to-face to minimise transmission, but also to continue to provide safe care to our communities.
So just to add to that, we'll be using that in our outpatient services. We did that previously, as Sarah mentioned, in 2019 and 2020. Outpatient services, we've used it with visitors. So we've, with patients who are in end-of-life care, successfully used, digital capability to support visitors. And then the state is planning, as Sarah mentioned, the majority of patients will be cared for at home, and so digital and virtual models will really enable that people to be monitored safely at home when they have COVID.
Thank you both. We did have a submission from the audience, and I might pass over to you, Mark, just to, it is a sort of more of a individual patient concern, so I might just pass over to you if you wanted to.
Thanks, Jen. So we've got a question from the audience, which I shall read out. It says, why, if a patient is admitted to Flinders Public Hospital and then transferred into the private hospital because they have private cover, does that patient then need to be transferred across the public system for a lung draining when the staff in the private hospital nurses are trained and capable to do this procedure? Further, why does it then take an external family member to call specialist rooms on Brighton Road for that patient to even get the care they need? And this was for an 81-year-old terminally ill patient. What I'm going to do in a minute is to actually hand to Sarah Woon and to Wayne Gadd for any general comments about how we deal, how we interface between the public and the private. And I guess with respect to the specific circumstances, it's a little bit difficult to give an exact answer without knowing further detail. And what I'd like to do is to invite the person who submitted the question to come and speak with probably with Wayne or with Sarah offline, and we'd be very, very happy to respond to that. But the question raises some important issues there around how we do interface and some of the frustrations that happen when we're trying to really get the best thing for our loved ones. Sarah, do you want to quickly start, and then Wayne, if you've got anything further to add?
Sure, thanks, Mark. So I guess there are a few arrangements. We, as you know, Flinders Private Hospital is co-located on site with Flinders Medical Centre, so there is a close relationship there. There's a relationship for patients with private cover. If they elect to use it and be cared for in the private hospital, that can occur through our emergency department. We share an emergency department in that way. But we also have an arrangement where, and as I alluded to in the COVID capacity and the planning, where we do purchase private beds for public patients in that Flinders Private Hospital. So there are a few arrangements in place, one for private patients and one for public patients in periods of high demand or in preparing for the for the pandemic. Absolutely, very happy to follow up those specific details. We work closely with Flinders Private in terms of communicating and sharing information and transferring, where appropriate, medical records for continuity of care. But very happy to take and look further into that patient incident. And Di, do you want to make a comment?
Thanks, I guess I just wanted to make one comment that we're really serious about providing really excellent patient care. So if there's any patient journey where people feel that their care hasn't met their expectations, we absolutely want to hear about it. We have a consumer advisory service. We always respond to verbal or written complaints, and it's an opportunity to learn and improve. So, encourage anyone to put that concern in writing to us so that we can actually look at it. And we as an executive look at that, every day, and we take that really seriously. So, I guess I have an oversight of clinical governance along with our Executive Director of Nursing. So, absolutely want to hear about things so that we can understand how we can improve.
Thank you, everyone. We'll move on to some more Slido questions. We've got I'll go in order of timing, because we've got quite a few actually. We've got one that says, you guys are awesome. Keep up the good work. Our health services provide great outcomes. Does anyone on the panel have a nice story that they would like to share? And maybe, Peter, you might have one that you deal with a lot of patient family reps. Is there a specific that comes out?
Yeah, that'd be great if I could do that. A positive story. Earlier in the year, I'd never been a consumer, although I was a consumer rep, and I had a stroke earlier in the year, and I suddenly had to see all of the stuff about what happens when you get an ambulance, what happens when you get admitted into ED and then into the stroke ward and so on. Saw some great treatment inside of the hospital. But more importantly, it began a journey of what we might now call goals of care. Because what was worrying me at that time was my physical treatment of how I was going to be able to function, etc. But other things, such as how I was going to be as a family member with my own grandkids, would I be able to enjoy their health and their enjoyment and happiness along with them. And then I got involved with taken home and was used, I spent probably 2 weeks with home care with a digital device, an iPad, where I was able to undergo occupational therapy and also speech pathology. And also I was able to have people visit me in the hospital before I was then able to be an outpatient for day rehab. So the process there reminded me of 2 things. One, SALHN is a caring organisation, and the care I received was great. Secondly, I think the thing about being involved with my own rehab, etc., reminded me how important that is as all parts of SALHN to be involved in patient-centred care, where the patients are part of the shared decision-making. And their goals are their own goals, as well as the treatment, the one about what the real care is about.
Can I follow up with that, Fran? I think Peter mentioned goals of care, and I'm the exec sponsor for a big piece of work where we started 6 months ago that's ongoing, which is really about, from a patient's perspective, what matters to you, not what is the matter with you, but actually what matters to you. So we've been co-designing it with our consumers to actually, through their patient journey, make sure that we have conversations about that. And in doing that, in answer to your question actually, we've been going out and seeking from all of our departments and divisions and units quality outcomes, and particularly patient experiences. So for example, PROMs, which are patient-related outcome measures, we measure that in SALHN. We've got amazing examples in cancer services with Bolter Koswara. We've got Nikki Dean in plastics, who actually truly measure the patient experience, so along with the quality outcomes. So we're gathering all of that data rather than just hearing about it by the by, and doing that improvement work.
Thank you so much, Di, for that. We do have a couple more. We did have one about care, Sarah Woon. It says, how will the aged population access care in relation to making first contact and transport to the repat?
Thanks, Fran. The care service is a partnership approach with the SA ambulance service. So in the first instance, the approach and the pathways to care are through the ambulance service. So as you would have seen in the video, it's a service, a complex and restorative service is what it stands for. It's geriatrician-led with experienced nursing and allied health staff, and it's really for older South Australians or people in southern Adelaide to access urgent care, but it may not be life-threatening. So a common pathway is a falls pathway, that a person may have fallen at home, called their ambulance service, and instead of going to the emergency department at Flinders Medical Centre, they're able to be transferred to the care service at the repat health precinct, where they can access urgent care led by a geriatrician with nurse consultant and allied health support. And the feedback that we've received has been really positive from the consumers that have gone through that service. Certainly a timely service, it's access to radiology, support service around it, and consumers are able to get back home much faster.
Thanks, Sarah. Open to the whole panel. We've got a question here. How are staff feeling now that the borders are open? It's a bit general, but maybe you could, not just for staff, but for your teams or for yourself, whoever wants to go first.
I think we could all answer that, really. I think, look, the staff, like the rest of the community, are feeling a little bit anxious. I mean, that, wouldn't be the truth if we didn't say that. So everyone in the community is a bit anxious because we've been so well protected from COVID in South Australia for so long. So there is a level of anxiety. So I think our role as senior leaders is to actually really communicate with them, listen to them, help reassure them and communicate the plans. And Sarah's been doing an incredible job going around the entire of SALHN, actually communicating the plans and the readiness so people understand, because that in a sense will then decrease their anxiety. So acknowledging that, but actually really well prepared. We've been liaising through the experience of our interstate colleagues, so we've had a lot of really rich information from them, I'll hand over to you, Sarah.
No, I think you've answered that perfectly. I think communication is the key, and I think, Fran, you need to acknowledge the work that you're doing to support us with that as well. So it needs to be different modes of communication, so, face-to-face, but we're doing live streams, we've got a Facebook page, so we're trying to make sure that we can sort of capture and keep everyone informed. But I think the important key to it also, to be successful, is to remind everyone that it's very agile and that it will continue to change and that we continue to learn. So we might be at this position today, and I've already had that today, we've already changed the plan halfway through the day. So people need to be aware that the plans will continue to change.
We'll move on to the next question, and maybe I'll start with you, Tamara, and anyone else that wants to comment. But it says, can you provide some sort of concrete ways to ensure that people who do not have the digital capacity or access will not get further marginalised in their healthcare? So, how do we get other groups in our society to really go into that digital priorities that we've been talking about?
Yeah, I think that's a really important question, and it comes back to having those range of different options and not forgetting things like liaison, either in person or via telephone, having different sets of outreach workers and people that are not reliant on someone coming into a space, that we can actually be going out and working in partnership with general practitioners, but also with the broader primary healthcare sector and the workers that are working in primary healthcare, perhaps also in broader primary healthcare fields like alcohol and other drug services. Some of those services are more advanced in terms of connecting with communities and people that experience vulnerabilities and disadvantage, and it's about ensuring that we have that level of engagement, that we can work in a nimble, seamless way across different agencies as well as within our own agency to offer those different options. The role of liaison in Aboriginal hospital care has been a really good example of the possibility of looking and using a workforce differently, so looking at Aboriginal health workers and Aboriginal health practitioners as points of contact for Aboriginal community. So we've got some good models that we could potentially work on that look at different ways of keeping those connections open and using people to people for those connections.
If I could add a little bit onto that, our consumer COVID reference group has a particular focus on people who may be veterans, elderly, come from a diverse linguistic and cultural background and so on, and from mental health and so on. That's adding as well. But I think it really also comes down to our principle at SALHN called Listen, Act, Make Better Together. And I think that's the critical point of actually saying we're going to need to listen, act and make better together by listening to the needs of the people who are there. So that means becoming things like our consumer group, for example, is looking at how might we advertise and look at the concept of patient advocacy. How do we actually then work not only with people but for people in an advocacy role to ensure that they are actually helped along the journey to actually ask those questions, receive those things that they need to be, and become part of the shared decision making.
Thanks, Pete. Super important. We've got one last one from Slido, and then I'm going to do a sort of last one from me. You've mentioned an increase in bed capacity, I guess through COVID and through other means. Has there been any increase in staffing, or are staff being redeployed? Sarah, probably one for you.
Oh, yeah, I'm happy to start with that. Yeah, so when I talked about bed capacity, absolutely the support, the resources, staffing, support services, and all the, support that needs to go around a bed, whether that's a physical or a virtual bed, has absolutely been resourced. I mean, staffing is the most important aspect in caring for consumers, and so there has been an increase in staffing. It's about an $11 million investment to support those, to create that capacity, and that's majority of that is through additional staffing, and recruitment's underway at the moment to support that.
Sarah. I think a few APMs ago, a question I asked was, what would SALHN look like this time next year? And I don't want to ask that one because COVID has kept us on our toes and things change very much. But I wanted to ask each of you, and our board members are here as well, what do you like most about working in healthcare or representing healthcare in the terms of the board? So I don't know who wants to kick off, but I'll hand over to the panel.
I'll go. Oh, you go. Yeah, I'll go down the line. Great. I think one of the things I like is what I see is a shift in thinking, both amongst clinicians and colleagues, as well as amongst patients and families, and that this is the business of wellness, not necessarily the business of illness, and that wellness is what we want for our staff, as well as what we want to achieve to the best of our ability for patients and families. And at a community level too, we want our community to come out of what's been a very fearful time and come out stronger and more able to act cohesively together and work for each other, like Peter was saying. Not necessarily that individual focus where I think we've all been separated and restricted from seeing each other. And those separations, while necessary, we need to be able to reconnect and keep each other bonded in a very safe and healthy way.
And I'd add on to that, similar to some of the things I've said already, is that I'm not from health and therefore a retired person and from another profession, and what I've done is had to learn about health. And what I've learned is that there are a whole heap of people who are committed to care of me, my family, my community. And they will do that by working both together as a cohesive professional group, but they'll also work together as welcoming people who can actually give a consumer perspective and listen. So this listen, act, make better together isn't just a principle, it's actually something that happens.
Peter? My background's as an allied health clinician, and one of the things I found when I came to Southern Adelaide Local Health Network and to Flinders Medical Centre was the unique quality of the team and the real ability for everyone to work together and for professional silos to really be broken down, which is quite unique, in fact, in my experience, a unique quality of Southern Adelaide. So what really excites me about healthcare and I guess the future of healthcare, Fran, is the opportunity to connect, to better integrate healthcare, to not only within the hospitals, to better integrate and to communicate for patients, for better outcomes, but also outside the hospital walls. So better integration with primary health, as Tamara mentioned, better integration with social services, and so I really see that as the future, and that Southern Adelaide can really step into that space as a leader and take that on.
Oh, it's a bit of a hard act to follow, isn't it? So I will say it in a couple of words, and I think for health for me is about making a difference, and I think we're very privileged to be working in health, and I do think that we do make a difference, so it's a privilege to me to work in health.
Yeah, and I'm a paediatrician and active clinician. I'm looking after the ward of sick kids this week, and it's an absolute privilege to work in SALHN, to work alongside our amazing staff, all of them. A particular shout out to our amazing nursing staff actually as well. I'm a true public servant. I have spent a lot of time this year thinking about our culture at SALHN, and I'm really proud of our culture, and I think in another 12 months I just want to see that build even more to be we're a collaborative collegiate culture with a flat hierarchy with everyone's voice can be heard. We want to equip our clinicians to be really skilled to be able to look after our patients. So I'd like to just continue to build that really amazing culture and have a reputation that really stands out in the state for that.
Thank you very much, and ladies and gentlemen, thank you for your questions and for your comments. Thank you very much for your support. With that, I'd like to draw to a close the formal proceedings. I'd like to thank our speakers, Julie Mitchell and Wayne Gadd, and of course to our panellists, to Di, to Sarah, to Peter and Tamara. Thank you for sharing your insights with us this afternoon. To our audience and members of community and stakeholders, for those who are able to be here, it was lovely to see you all. Thank you all very much for taking time out of your busy days to come to our annual public meeting. And for those that are joining us online, again, thank you for your participation. It is a busy and challenging time to be in healthcare, but it's also one of the most rewarding times to be in healthcare. Ladies and gentlemen, thank you very much. I look forward to seeing you at future events, and for those that are with us physically, please come and join us for some afternoon tea. Thank you.